Let's now go to integumentary disorders. Let's discuss palpation. While much of the skin examination can be accomplished through visualization, valuable information may be gained by palpating and manipulating the skin. The palpated epidermal and/or dermal features of a lesion can be demonstrated with relative ease, assisting in formulation of a diagnosis. Consistency, turgor, temperature, mobility, and tenderness are among the valuable findings of palpation. Remember to wear gloves when palpating lesions and open skin. Assess the temperature, level of moisture, and texture of the patient's skin. Skin should be cool or warm to the touch. The temperature of the examination room may affect the temperature. Skin should not be overly moist or dry. Overly moist skin may indicate temperature regulation problems. Dry skin may represent hyperthyroidism. Skin should feel smooth. Very rough skin could suggest a keratization disorder. Extremely cracked or fissured skin may be chemically injured or cirrhotic. Very smooth or slightly depressed skin with absence of superficial features is usually a scar. Here we can see in the figure the testing skin turgor. Test skin turgor, gently pinch the patient's skin between your thumb and finger and then release it. The skin should spring back into place. Palpate lesions. Depending on the type of primary or secondary lesion identified during inspection, use the following technique. Squeeze or apply lateral pressure to localize the level of lesion. The dermis is fibrous and can be picked up and moved over subcutaneous nodules of deeper lesions of muscles or bone. Squeezing can sometimes force fluid or semi-solid matter out of the skin, which can help with diagnosis. That is, squeezing an edematous extremity. Next, scrape the skin surface to provide information about superficial lesions. Dermatophyte or psoriasis plaques are of epidermal location and shed scale very easily when scraped with a number 15 blade. Plaques of granuloma annulare that often mimic a dermatophyte do not shed scale when scratched. Thick crusts overlying ulcers can mask the depth of dermal involvement. Removal of surface crust improves assessment. Apply linear pressure or rub the skin surface with a blunt, narrow object to release the inflammatory mediators in cutaneous mast cell disorders exhibiting characteristic dermatographism or an urticarial wheal. Lateral pressure applied to perilesional normal skin or active pemphigus blisters causes shearing away of the epidermis. Use sparing to aid in the differential diagnosis of corns and warts. Tearing the surface of a corn reveals smooth, often shiny keratin kernel. A paired wart will exhibit small dark vessels. Next, perform a hair pull test. Grasp around 60 hairs between the thumb and finger. Apply slow, constant traction. Traction against the scalp should not yield more than 6 hairs. If it does, inspect the bulbs for stage. Palpate nails. Assess texture, temperature, and tenderness. Nails should be smooth and firmly adhere to the nail bed. Palpation should not elicit tenderness. Bacterial infections of acute and chronic paronychia are easily distinguished by the warm tenderness, swelling, and erythema that are present. Pairing the nail bed may be helpful. Pairing the surface keratin of the nail enables the assessment of a nail bed or confirms the presence of blood in a suspected subungual hematoma. Thank you for your attention.